They may receive teeth in just 3 days period of time. That's the best part of the immediate functional loading. The immediate functional loading of an implant is a procedure in which the implants are placed in patient's jawbone and patient receive teeth in 3 days period of time. Whereas in conventional delayed loading of implants, after placing an implant in patient's jawbone, patient have to wait for approximately 2 months to 8 months period of time. In immediate functional loading of implants, patient did not have to wait for such a long period of time. They may receive teeth in just 3 days period of time. That's the best part of the immediate functional loading. The immediate loading serves better because the implants are engaged in the cortical bone. Cortical bone is a very strong bone of the jaw. It has excellent mechanical property. It is highly mineralized and it is very strong. Of course, it can withstand a high amount of force. Okay, so that is the reason the cortical bone helps us to load the implants immediately, and these implants are engaged in this cortical bone. Whereas in conventional implant, it takes 2 to 8 months period of time because these implants are engaged in the cancellous bone. The cancellous bone or the spongy bone, they are not very strong enough to withstand the forces immediately. So they take 2 to 8 months period of time. Although the immediate loading is new in dental implantology, but it has been practiced since many years by our orthopedic doctors because they rely on cortical bone. Even after the hip joint replacement, patients are made to walk after 3 days period of time, and you can just imagine this hip joint implants can take the load of whole limb, then why not a dental implants? Even if the dental implants, if they are engaged in the cortical bone, it is possible to load the implant immediately and patient can achieve effectively after 3 days period of time if we are in the cortical bone. Patients seeking replacement of few missing teeth or completely missing teeth can receive their teeth in 3 days period of time. Although the follow-up form the most important aspect of the treatment, we recommend our patients who are coming from far to stay for a period of at least 1 to 2 weeks after the treatment. So during this 2 weeks period of time, we can do their necessary follow-up, we can check the achieving of pattern, any problem if they are facing, we can rectify those problems, and of course this will definitely improve our success rate. If you have multiple compromised teeth or loose teeth, you can immediately replace them with immediate loading implants. Our treatment approach for such cases are different. Implants can be placed immediately after the tooth extraction. We provide sanitary spaces between the gums and the processes so that the healing of the extraction socket is not hampered. Patient can easily clean this area as they are self-cleansable. The prostheses used in such case are hybrid. They are also called as semi-permanent prostheses. After 1 to 2 years, if patient desires to change this hybrid prosthesis, they can change it to metal ceramic or zirconium prostheses. Another approach to avoid sanitary spaces is to wait for minimum 2 to 3 weeks period of time after the teeth extraction and then place an implants. This can achieve excellent soft tissue healing and the patient can avoid sanitary spaces easily. If you have limited jawbone and you have been told that you cannot receive the implant treatment, then need not worry. With the immediate loading cortical implants, it is still possible to receive a teeth even in most deficient compromised jawbone. The rationale behind this approach is we engage the basal cortical bone. There are 2 types of bone in the jaw, that is alveolar bone and the basal bone. The alveolar bone is that bone which is tooth dependent, and in this region the tooth stays. The moment the tooth is extracted, the alveolar bone resorbs slowly if the implants is not replaced in that bone. Whereas the basal bone is that bone which is always resorption stable and which is always available when there is even high atrophy of the jawbone. So our implant treatment is intended to engage the basal cortical bone. That is the reason even in most compromised or most limited jawbone cases, it is possible to restore the implants within 3 days period of time by engaging the basal cortical bone.